أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف خلق الله محمد بن عبد الله وعلى آله وصحبه وسلم. السلام عليكم ورحمة الله.
وعليكم السلام ورحمة الله.
وعليكم السلام.
Inshallah, by the end of this lecture, we will finish this course. Today, inshallah, we are going to discuss the very short lecture about the thyroid and parathyroid imaging. As you know, the thyroid consists of two lobes, right and left lobe, which are connected in the midline by the isthmus, and the thyroid engulfs the trachea. It engulfs the trachea, and the posterior surface of the thyroid, there are four small glands, parathyroid glands. Parathyroid glands are very small and located posterior in the posterior aspect of the thyroid gland. For the evaluation of thyroid and parathyroid, we usually perform ultrasound and nuclear scintigraphy or radionuclide studies, CT scan, and biopsy, which we usually done by the ultrasound or sometimes CT guided, but usually done by ultrasound guidance. So for the imaging of the thyroid gland, as we mentioned, thyroid usually imaged by ultrasound. As also thyroid is very sensitive for radiation, and we are trying to avoid the radiation technique such as CT and nuclear technique or on X-ray and fluoroscopy, and usually we evaluate the thyroid by the ultrasound. Also, as we mentioned, we can use fine needle aspiration with for cytology after aspiration of the thyroid nodules, and this is the mainstay diagnostic tools, ultrasound guide, which is done by ultrasound. Fine needle aspiration for the thyroid nodule. Nowadays, it is the mainstay of diagnosis. Yani any patient present with thyroid nodule, for this patient, you have to do fine needle aspiration, which is done with ultrasound guided. Other technique will be used for thyroid is scintigraphy, radionuclide technique, which is usually done for assessment of the function or abnormal function of the thyroid rather than the anatomical details. Yani in the scintigraphy, this technique helps us in assessment of the abnormal function. Is it increase or decrease? Is it hyperfunctioning or hypofunctioning with thyroid? And it gives us a minimal information about the anatomical details of the thyroid. CT is not usually used for examination of the thyroid, but it can be used for assessment of the retroesternal or intrathoracic extension of the goiter. Sometimes the thyroid may be enlarged and extend downward into the thorax as the area of the posterior to the sternum, and this is called the retrosternum or intrathoracic extension of the goiter. This extension can be assessed by CT. سابقا كان بنعمل X-ray، لكن nowadays CT is more help. سابقا كان بنعمل X-ray حاجة يسموها شنو thoracic inlet. يعني this is a special views for assessment of the retroesternal or intrathoracic extension of the thyroid or يعني اللي هي goiter. This CT can demonstrate the extension of the thyroid intrathoracic, and also can demonstrate if there is a mass effect, اللي هي compression of the trachea by this enlarged thyroid or the goiter. يعني goiter can push and compress the trachea as the thyroid is related to the trachea. So if it is enlarged, the thyroid may compress and deviate the trachea to the other side. Concerning the normal appearance of the thyroid on the ultrasound, this is a transverse scar of the thyroid at the level of the neck. The center area, this is the trachea. This is the trachea of the center. Lateral to the trachea, there are two lobes. This is the left lobe of the thyroid, and this is the right lobe of the thyroid. This is the isthmus, which connects the both lobes. This is the isthmus. There are two vessels related to the thyroid. This is the artery, which is a common carotid artery, left one, and this is the right common carotid artery. Lateral to the artery is the vein, the jugular vein. This is the left jugular vein. The right one is not uh, uh, documented in this view. These are muscle, the sternocleidomastoid muscle and the strap muscle. This is the muscle. You can look and see the thyroid tissue appear echogenic or hyperechoic than the muscle. The echogenicity of the thyroid on the ultrasound is hyperechoic to the muscle. So this is the, again, this is the common carotid artery, left one, right common carotid, the jugular vein, right, the jugular vein, left, is the left lobe, right lobe, isthmus, trachea. These are the muscles, and also this is ultrasound demonstrates the same path, the same, anatomy. And this diagram explains the trachea in the center, the right and left lobe connected by the isthmus, the internal carotid medially, and the jugular vein is lateral to the internal carotid artery, and these are the muscles, the sternocleidomastoid and the strap muscles, which are located anterior to the thyroid. This is the normal appearance of the thyroid. So ultrasound used for, this is the probe. This is a probe uh, handled by the operator and put in the anterior neck. This is which should be extended like this. This is extended neck, and the probe should be put in the anterior aspect of the neck at the area of the thyroid for to assess the thyroid to visualize the thyroid gland like this. So ultrasound is the investigation of thyroid, as we mentioned, and the thyroid gland consists of two lobes, right and left, connected by the isthmus. And this is the black and white ultrasound. This is a grayscale ultrasound. But we can use color double ultrasound for assessment of the blood vessels. زي ما قلنا كل ما نقول color double, try to remember إنه this technique used for assessment of the blood vessels. The color double can be put, this is في knob معين, you can press the knob and administrate the flow in the vessels. So ultrasound, color double ultrasound can be used for assessment of the vascularity for the major arteries and veins, common carotid and jugular veins, and if there is a mass, is it vascular or not, if there is a normal vascularity of the thyroid or increase or decrease. Also, ultrasound can show the anatomical details of the thyroid, and also by the Doppler you can assess the blood vessels. Normal appearance of the thyroid appear homogeneous, medium to high level echoes. Usually we compare this the thyroid to the muscle. لو لاحظت هنا كانت more echogenic، أكثر بياضا من المصل. Some also it may be of medium equality، isoechoic to the muscle. So the thyroid, it may be hyperechoic compared to the muscle, or medium to it, or isoechoic to the adjacent muscle. طبعا زي ما اتكلمنا قبل كده انه الالترا ساوند هي دايما help us in differentiation of between the nature of the lesion, especially يعني to differentiate between the cystic lesion from the solid lesion. يعني نعرف ان هي هل الليجن دي هي cystic or solid، لانه قلنا دي مهمه جدا may shorten the, the differential diagnosis. And also in thyroid lesion of cystic pattern, usually this is a simple cyst and are invariably benign. يعني لما نلقى cystic lesion in the thyroid نحن نرتاح شويه لانه invariably benign. This is simple cyst لما نلقى cyst. لكن if there is a solid lesion دي نحن نخاف منها لانه solid mass or lesion could be carcinoma or adenoma. لكن بنخاف يعني this patient should be investigated more to exclude carcinoma. طيب احيانا بنلقى lesion يسموها complex lesion containing both parts cystic and solid part. So this usually benign. It could be malignant but usually benign. So إذا عملنا ultrasound if there is a cystic lesion this is invariably benign. If it is a solid this could be carcinoma, most likely carcinoma or adenoma. So this lesion should be evaluated more, assessed more by the other technique. And if there is a combined or complex lesion containing both components, solid and cystic, this usually benign, but still it could be malignant. The other technique for assessment of the thyroid is radioisotope study or nuclear medicine or nuclear scintigraphy, in which we can inject radiopharmaceutical or given the agent orally. So there are two routes for administration of the radioisotopes to the patient for assessment of the thyroid. It could be given orally or IV, intravenously. The thyroid, when the patient receives the agent intravenously or orally, the thyroid and parathyroid will uptake the agent or isotope. There are many radio pharmaceutical agents or radio tracers. There are many. For example, in oral, usually we use iodine 123 or iodine 131. For the IV agent, radioisotope or radio tracer agent, the commonest one is technetium 99M berticnidate. But there are other max 3 or other, but this is the famous one, technetium 99M berticnidate. How the normal thyroid appear on nuclear medicine technique or radioisotope study? Normally, the thyroid appear of normal size with evenly distributed activity. It will uptake the radio tracer evenly. And this already, as we explained this slide, this is a normal radioisotope study. After we inject the agent, this is the first image. You can see there is a uptake of the agent, then uptake increase, and there is uptake increase, and this, but it is evenly distributed symmetrically. There is no area of increase or decrease uptake. It is symmetrically uptake by the thyroid gland. So this is the result. This is a normal uptake of the radio tracer by the thyroid gland, and also this is a radio. طبعا لما ننتظر زمن بيحصل شنو resolution of the of the agent. يعني اول بدايه يكون very dark بتقل الداركنس by the time. ولكن you can see there is a evenly distributed uptake of the radio tracer by the, this is a normal. طيب نجي نتكلم عن ال indication for the radio tracer or radio pharmaceutical or radio nuclide for the thyroid assessment. زي ما اتفقنا ان دايما لما نقول لك الراديو pharmaceutical or nuclear medicine technique usually used for assessment of the function, and it gives us less information about the anatomy of the organ. So it can give us less information about the thyroid in this part. But there are many indications. This radiopharmaceutical or radionuclide scan for the thyroid can be done for assessment of the thyrotoxicosis or Graves' disease or hyperplasia or functioning nodule or thyroid cancer. طيب عندنا terms زي ما عندنا term in the CT, terms in the MRI, ultrasound, also there are terms you should be aware about them. The first one is functioning thyroid or thyroid nodule will show high uptake. أي nodule ذات بتكون functioning يعني more functioning بنسميها شنو؟ بتكون عندها شنو؟ high uptake. بيكون عندها not evenly uptake. بيكون الفانكشننج nodule ده بيكون demonstrate شنو؟ high uptake يعني بيكون more darker than the other part. And a nodule with high uptake, the term for high uptake nodule بنسميها hot nodule. إذا hot nodule demonstrate high uptake اللي هي بتكون functioning nodule or شنو؟ high uptake. طيب إذا كان عندنا non functioning nodule هيكون عكس non functioning nodule معناتها will show شنو؟ low or no uptake. دي هتكون non functioning. طيب هنسميها إيش إذا كانت low or non functioning؟ زي ما كانت الهاي functioning سميناها high uptake كانت hot nodule. This is called cold nodule. So cold nodule is the nodule that is non-functioning and it shows low or no uptake. يعني الابتيك in this area of cold nodule بتكون شنو less than the other part. طيب نحن which one is more hazardous؟ فإن إذا عندنا cold nodule زي ما قلنا هو بيكون شنو low uptake. فالهوت نوديول دي usually يكون benign. الهوت نوديول زي ما اتفقنا هو بيكون شنو؟ shows شنو high uptake. This hot nodule is usually benign يعني احنا ما بنخاف من الهوت nodule. لكن إذا كان عندنا cold nodule which shows low uptake or non-functioning يعني nodule بيكون usually malignant. According to this, this is a thyroid scintigraphy. You can see this is the neck and this is the radiopharmaceutical agent uptake by the thyroid. This is normal functioning or hypofunctioning or hyperfunctioning nodule?
hypo or non-functioning.
So this is nodule called what? The current hypofunctioning is cold nodule. So this is a cold nodule. On this is thyroid scintigraphy. You can see this is a cold nodule, which in the left thyroid lobe there is a decrease radio tracer uptake. هنا في قلل uptake لأن هنا normal uptake, but in this area there is a low uptake. There is a low uptake or كأنه absence of uptake. But the other part of the thyroid shows normal uptake. So this is called بنسميها ايش؟ name a cold nodule. زي ما اتفقنا انه الكول نوديول عندها high risk of malignancy. So for this patient you have to do further evaluation, further workup by usually زي ما قلنا the mainstay imaging technique for assessment of the thyroid nodule is fine needed aspiration. فإذا البيشنت ده بيحتاج ل fine needed aspiration for to exclude malignancy لأنه this is a cold nodule. In the other image this is a cold or hot nodule?
Hot.
This is a hot nodule because it demonstrates increase uptake. Any area of increase uptake زي ما قلنا هي بتكون hot nodule. But this is a nuclear median thyroid scintigraphy by technetium 99M. Demonstrates this is the right thyroid lobe rounded area of increased uptake. So this is a hot nodule. لاحظ انه this area is demonstrate high uptake but the other part demonstrate normal uptake. فإنها دي الهوت نوديول دي ما بنخاف منها لكن بنخاف من this cold nodule because this cold nodule is usually malignant. فإذا this is a normal thyroid. You can see the uptake evenly uptake of the radio tracer in both lobes. In this is a cold nodule because there is decrease decrease uptake. and in this one there is increased uptake, and in this one there is a increased uptake, but this is the more darker than this. This is called warm. يعني هي not hot، يعني بنستخدم الترم دي for not very dark. يعني إذا كان ما عندنا very increase uptake، يعني الآن كده هو دي black more blacker، فده بنسميها hot nodule. لكن إذا كانت not more blacker not very dark sometimes we can use warm nodule. فهي يعني هي الورم والهوت الاثنين طبعا بالنسبه لنا increase uptake يعني. And here there are many area nodules of high uptake. This is a toxic multinodular goiter. عندنا multiple nodules demonstrates high uptake. This is a toxic multinodular nodule. This is a grave disease. In grave disease, the thyroid lobes will be enlarged and demonstrate diffuse hyperfunctioning or increased uptake. لاحظ انه في increased uptake لكن شنو diffuse not focal، ما في nodule. There is diffuse increased uptake of the thyroid gland, and this is a thyroiditis which demonstrates عندها many pattern of uptake. So this is a slide demonstrates the normal and abnormal uptake of the radiotracer by the thyroid gland. CT can be used for the assessment of the thyroid gland. This is CT at the level of the neck. This is cervical neck, and this is trachea, and this is thyroid engulfing the or hugging the the trachea. But this is the thyroid, and also this is a thyroid in which there is a nodule. The thyroid gland is contrast demonstrates this nodule. This is a solitary nodule. So CT also can be used for assessment of the thyroid gland. But the diseases of the thyroid that inshallah we are going to discuss, some of these we may discuss the functional disorders such as hyperthyroidism and hypothyroidism, and inflammatory condition Hashimoto disease, and nodular disorder, simple goiter or multinodular goiter, tumor such as benign tumor adenoma or malignant tumor carcinoma. The grave disease is the cause of the hyperthyroidism, in which the ultrasound can shows an enlarged hypervascular thyroid. This is a thyroid gland. لاحظ انه الكلر دبل ديمونستريشن هايبر فانكشنينج مور فاسكولاريتي، يعني لاحظوا الكلر دي بقت كثيره مره. So there is increased vascularity and the thyroid lobe is enlarged. لو مذكرين in grave disease in nuclear medicine زي ما اتفقنا shows diffuse uptake of radioactive iodine زي ما شفنا هنا. grave disease in radio the thyroid gland appear diffusely enlarged with increased uptake, with increased uptake. So this is a show diffuse uptake of radioactive iodine in the radio or nuclear scintigraphy for the thyroid. So this is ultrasound doubler, not gray scale or لاحظوا البوكس دي بس في النوب معين بنعمل نضغط عليه بيظهر لك البوكس دي. You can move this box and put it on the area of the interest. مثلا then to assess the thyroid lobe. The thyroid lobe here is enlarged with increased vascularity. So this is a grave disease. So grave disease characterized by these findings on the ultrasound and the nuclear scintigraphy. Tumors هنتكلم عن السونوجرافي science of benign tumors such as adenoma. Usually the benign tumor we classify them into sometimes in two groups, low risk and benign. Sometimes في ناس بيقسموها low risk intermediate risk and benign. يعني عندنا يعني nodule of risk or malignancy and benign. يعني benign دي معناتها احنا the features of benignity يعني appear on this lesion. when there is a isoechoic or hypoechoic solid nodule on the thyroid هي فيها risk. It could be malignant يعني not totally احنا نقول خلاص 100% this is benign. إذا كانت nodule solid nodule لكن isoechoic or hyperechoic. دي بنخاف منها. اما اذا كان عندنا cystic nodule with eccentric solid، يعني عندنا two components cystic and solid component، دي برضه هي risk of to be malignant. او اذا كانت partially cystic nodule، partially cystic nodule يعني برضه بنفس الطريقه، فيها شنو؟ فيها solid وفيها area of cystic part. فكل الفيتشر دي عندها risk of to be malignant. ما بنقول خلاص البيشنت اذا عنده اي واحد من دول ما بنقول البيشنت ده خلاص روح والحمد لله، لانه this need يعني more it could be follow up or يعني immediate investigation according to يعني many features. يعني لكن if the lesion is cystic nodule with anechoic without solid component، يعني دي this is a usually بنقول خلاص الحمد لله انه this is benign tumor. اذا cystic nodule اذا ما فيها اي اي benign part، ما في اي benign، ما في اي solid part، ما في اي component of solid component، فدي cystic pure cystic. this is usually or يعني 90 or 99 or 100% benign tumor. لذلك نحن نخاف من ايش؟ من السوليد totally solid or partially solid، لكن cystic الحمد لله بتكون usually benign. طيب for as the example of inflammatory diseases of the thyroid, we are going to discuss the Hashimoto disease, which is the common form of autoimmune thyroiditis, and it can lead to the hypothyroidism. What are the features of Hashimoto disease on ultrasound? طيب الانديكيشن ايش؟ انديكيشن for ultrasound to assess thyroid size. يعني احنا بنعمل ليش الالتراساوند for the patient suspected Hashimoto disease؟ to assess the size and echo texture and to exclude انه في nodules. طيب what are the possibility؟ يعني according to the types of the Hashimoto disease عندنا there are two types. The first one is atrophic phenotype and the other one is goitrous. يعني احيانا بيكون الثايرويد reduce in size، دي بسميها atrophic phenotype، and when the thyroid becomes enlarged with heterogeneous structure دي بسميها goitrous phenotype. إذا عملنا ultrasound for the patient with Hashimoto's disease with goitrous phenotype like this is a color double ultrasound. You can see the thyroid gland is enlarged and it is hypoechoic compared to the other part and the surrounding muscle. It is hypoechoic with heterogeneous structure. Heterogeneity نشوف انه not يعني التكشر not equal in the texture، يعني في مكان hypoechoic، في مكان hyperechoic and so on. So this is enlarged hypoechoic heterogeneous texture lesion with normal vascularity. يعني ما زي الدية increased vascularity، زي the normal vascularity. لاحظ انه في color double انه في blood flow لكن normal. This is features of Hashimoto's disease goitrous type. In the Hashimoto's disease atrophic type, you can see this is the thyroid ultrasound demonstrate small or reduced size of the heterogeneous thyroid lobes. يعني thyroid lobes إذا قارنتم بين النورمال اللي شفناه من الأول، فإن this is the thyroid lobes are get small. There are reduction in the size of the thyroid lobes with heterogeneous texture. This is a suggesting of Hashimoto disease. إذا عملنا color doubler هتلقى إن الفلو within normal، لكن this is black and white. This is gray scale, not color doubler like this. طيب the other is pathology multinodular goiter. This is ultrasound. This is trachea, and this is the left lobe, right lobe. This is the common carotid and jugular vein. Here you can see there are multiple nodules. especially in, you can see this nodule, this nodule, this nodule. There are multiple nodules mainly on the right side. This is multinodular goiter. So thyroid ultrasound can demonstrate multiple nodules within the thyroid parenchyma, within the thyroid parenchyma. If we لو متذكرين how the thyroid scintigraphy appear, how the multinodular goiter appear in thyroid scintigraphy. كان وضحناه how multinodular goiter. What is the features of multinodular goiter in radionuclide thyroid or thyroid scintigraphy? How this disease appear, or how this multinodular goiter appear on the radio scintigraphy or radionuclide technique for the thyroid. متذكرين كان عندنا النوديول دي
هايبر فانكشن.
يس هايبر فانكشنينج بس حيكون شنو عندنا مالتيبل نوديول، يعني دي حيصير لك هايبر فانكشنينج and the hyper functioning يعني with increased uptake. يعني اي نوديول حيكون كل نوديول حيصير لك as the area of increased uptake. So increase radioiodine uptake by multiple hyper functioning اللي هي شنو نوديول، حتكون لنا multiple hot نوديول، لكن شنو not solitary نوديول، multiple hot nodule يعني shows شنو increase uptake. طيب is this patient required fine needle aspiration? No, for multinodular goiter usually not routinely required because this is usually benign. زي ما احنا قلنا بنخاف من ايش؟ the solitary، اكثر حاجه بنخاف من السوليتري and solid nodule. This is a multinodular goiter and this is trachea and this is thyroid. There are multiple nodules. يعني ده nodule and this is a nodule and this one is nodule. عندنا multiple nodules. أي واحدة من دي اللي حصلها well defined nodules. But this is a multinodular goiter shows enlarged thyroid with multiple nodules which shows contrast enhancement. يعني these nodules shows contrast enhancement. These nodules are multiple and of different sizes. يعني دي كبير شوية، دي small multiple. This is multiple nodular goiter. This patient usually or routinely no need for fine needed aspiration. طيب نتكلم شوية عن الثايرويد كانسر. تكلمنا عن الفانكشن، الهاشيموتو's disease، الجريف disease and benign condition. Thyroid cancer, thyroid ultrasound usually زي ما قلنا done for assessment of the signs of the thyroid malignancy. لذلك نعرفين لابد نكون aware about the features of thyroid malignancy ultrasound. أول شيء margins بتكون irregular margin. طبعا يعني دائما المالجنسي بتكون عندها irregular outlines or margins and it characterized by taller than wide shape. يعني tall أكثر من الويدث، يعني هي taller than wider than wide shape. فنعمل التراساوند in the longitudinal scan بنلقى إنه taller أكثر من شنو الوايد axis. Usually so also presence of microcalcification within nodule raising the possibility of malignancy. لذلك إذا لقينا microcalcification بنخاف منها. And also extrathyroidal growth. إذا كان thyroid الجروث extending to the adjacent structure، يعني invasive to invasion of the other neighboring structure. Also it is raising the possibility of malignancy. So you have to be aware of these malignant sonographic signs of malignancy. طيب for thyroid scintigraphy نحن ما بنعملها روتينلي، لكن it may be there are many indications. أول حاجة إذا كان عندنا thyroid nodules with decreased thyroid stimulating hormone level. إذا كان عندنا thyroid stimulating hormone level وعندنا thyroid nodules لابد نعمل شنو thyroid scintigraphy. Also in case of multinodular goiter sometime لكن multinodular goiter may be need thyroid scintigraphy إذا كانت في واحده من النديول احيانا بيكون عندنا مالتيبل في المالتينوديولار جويتر، احيانا بيكون عندنا في نديول عندها فيشر اوف مالجنسي. اذا كان في سسبيشس زي ده in this time you can do the thyroid scintigraphy to identify which nodule require fine needle. لكن اذا ما كان في indication for fine needle no need for this thyroid scintigraphy. لأنه usually this multinodular goiter not usually not fine needle not usually done for this uh, disease. Also, thyroid scintigraphy might be done before radioactive iodine ablation. This is a message of treatment of ablation of the tumor. But this is a radioactive iodine can be used for treatment of the thyroid tumor. Before these methods of treatment, you can do thyroid scintigraphy for assessment of this thyroid. طبعا الكونتر انديكيشن دي جنرال، يعني هي كونتر انديكيشن فور ذي ثايرويد، يعني حتى في الاذر سنتجرافي بريجنانسي اند بريست فيدنج وومن this is a counter indication for this technique. طيب how the الثايرويد كانسر appear؟ طبعا كلامنا مره بينا انه كلنا عندنا decrease or no ريجستريتر ابتيك، اللي هي بتكون عندنا هاي فانكشنينج اور نون فانكشنينج نوديول زي ما كنا سميناها كول نوديول. دي اللي الكلام ده كان وضحناه اذا كان زي زي قلنا الكول نوديول اللي هي نون فانكشنينج دي دايما بتكون raising the possibility of malignancy. لذلك اذا عندنا thyroid cancer usually it shows no uptake or decrease uptake اللي هي تكون non functioning or hyperfunctioning and it is called cold nodule. طيب اللي مكتوب تحت ده مهم جدا، انه any solid hypoechoic nodule with irregular margin، يعني اللي هي الفيتشر دي with microcalcification with taller than wide shape and extrathyroidal growth and or cervical lymphadenopathy should be raised suspicious of thyroid malignancy. اي patient نعمل له thyroid ultrasound نلقى الفيتشر دي you have to exclude malignancies. So this patient should be investigated more by fine needle aspiration cytology. لابد نعمل له fine needle aspiration cytology if the thyroid demonstrates this finding. So put this finding in your mind because this is raising the possibility of the malignancy. This is ultrasound. Can you report or interpret this image? Anyone? Any volunteer? By this ultrasound, this is a cystic or solid lesion?
solid.
Solid lesion. What about this? The spot, white spot. What are these? These facial white spots.
Is it microcalcification?
Microcalcification.
How about the margins of this lesion? Is it well defined or ill defined? Is it
Ill-defined.
Ill-defined.
well defined with microcalcification? So what is the most likely diagnosis or most likely suspicion?
Malignant.
This is a malignant because it is ill-defined solid nodule with irregular outlines and microcalcifications. So what should be done for this nodule for more
Fine
assessment?
needle aspiration.
Thank you. Excellent. What is this imaging technique?
Doppler.
Yes, this is Doppler what? Doppler ultrasound. Doppler ultrasound. So this is ultrasound Doppler technique for the thyroid. How to describe this lesion? Is this solid or cystic? طيب is it hyper or hypocoid؟ طيب نرجع لدي is it hypo or hypercoid؟
Hypo.
Hypocoid.
Hyper.
Yes. How about this lesion? Is it hyper or hypocoid؟ lesion هي دي كلها lesion.
It's mixed hyper and hypo.
Yes, it's mixing echogenicity.
Is
There
it
are
cystic and solid together?
this may be cystic part يعني لأنه clear anechoic, or it may be يعني of mix echogenicity يعني تكون هي والله solid، هي solid لكن شنو hypoechoic، يعني this is hypoechoic solid part and this is hyperechoic and this is hyperechoic. There are mixed of echogenicity. How about the outline of this lesion? يعني outline is it
Well
smooth,
defined.
well defined يعني irregular, well defined, lobulated. So this is also raising the possibility of malignancy.
Malignant.
Yes, thank you. What is this technique or this exam? Is it ultrasound?
CT.
CT. And what is this?
X-ray.
X-ray.
X-ray. But this is X-ray demonstrates this opacity. This is opacity. This opacity, you can follow it and you can see it is extending into the neck. So it may be starting from the neck and extending downward. And also, what about the trachea?
Dislocated. This place.
Yes, displaced and compressed. Displaced and shifted or so there is a lesion here compressing and deviating the trachea, and this opacity المنطقة البيضاء دي, this is abnormal طبعا. This is opacity of abnormal lesion, and you can see, follow this opacity and it is extending upward. So this is a retro or intrathoracic extension of the thyroid يعني goiter يعني goiter كانت starting طبعا اكيد in the thyroid لكن شنو extending into the thorax in the retrosternal area دي بسموها intrathoracic or retrosternal goiter. and زي ما قلت لكم سابقا كنا بنعمل اكس راي for the thoracic inlet، بنعمل A B زي دي او lateral to assess the شنو the retrosternal extension of the thyroid of the goiter or بنسميها شنو intrathoracic thyroid. Nowadays it replaced by the CT. Usually you can use CT. طبعا ما حيكون عندك سكشن واحد، انت لما يكون عندك CT حتشوف كل السكشن. You can follow this lesion from the neck downward till the يعني at the till it end. This is the thyroid enlarged thyroid يعني this is section at the level of the thyroid demonstrate how this thyroid is enlarged with heterogeneous structure. This thyroid this is a CT with contrast. You can see there is a patchy enhancement or heterogeneous enhancement of the thyroid. يعني في منطقة ما أخذت، منطقة أخذت أكثر فسماها شنو heterogeneous enhancement. and the trachea is compressed and deviated to the other side. لذلك نحن نعرف إنه إذا عندنا intrathoracic or retrosternal goiter nowadays you can do CT for assessment of this extension. زي ما how معرف مذكرين what are the differential diagnoses of anterior mediastinal mass اللي هي 5 تيز تذكروها. اما دي هنا برضه الثايرويد كان بي differential diagnosis of superior mediastinal mass. فزي superior mediastinal mass اللي هي in the X-ray عرفنا how to report it, and here this is the superior mediastinal mass extending from the you can follow it برضه in CT extending from the neck and down to the thorax in the retrosternal area. But this is a retrosternal goiter. What do you see in this image?
A fine needle aspiration guided by ultrasound.
Yes, this is a needle. You can follow this needle by ultrasound. يعني نكون عاملين واضعين البروب in the anterior neck to look to the lesion and advance the to look to the lesion, and we advance the needle to take fine needle to aspirate this nodules. This is a fine needle aspiration image to illustrate how the fine needle aspiration done by شنو by ultrasound guidance. طيب زي ما انتم عارفين انه الثايرويد اي ديزيز، الثايرويد can affect the appearance of the eye، بيسموها thyroid eye disease or exophthalmos. Exophthalmos is the protrusion of the globe of the eye. The thyroid eye disease characterized by enlargement of the extraocular muscle. Extraocular muscle. What are the extraocular muscle? ايش هي؟ Name the extraocular muscles of the eye. There are lateral muscle and oblique muscle, superior oblique and inferior oblique, and the lateral muscle. فإذا بيحصل لنا شنو؟ enlargement of the extraocular muscle. enlargement of the extraocular muscle. مثلا زي دي شايفين شنو؟ this شنو؟ medial rectus. this is a medial rectus and this is medial، لكن this is شنو؟ lateral rectus. احنا عندنا rectus medial and lateral، عندنا superior oblique and inferior oblique. Or this muscle may be enlarged in the thyroid eye disease. And now you can see the medial rectus muscle enlargement. The medial rectus and this is medial rectus. So there is enlargement of the extraocular muscle, usually bilaterally, and this can affect the appearance of the eye, and also there may be hypertrophy and edema of fat behind the orbit. لاحظوا المنطقة دي فيها الفات، ريترو اوربيتال فات. الفات دايما اون سي تي بيكون بلاك او نيجاتيف سي تي نمبر زي ما متذكرين، يكون توتالي بلاك. فذيس there is a accumulation of fat and هو hypertrophy of fat and edema behind the orbit. Also this can can be lead to more compression of the eye, and also can compress the optic nerve. This is the optic nerve. This is the optic nerve also can be compressed in the area of the apex of the orbit. فلذلك نعرف انه in the thyroid eye disease characterized by what? Characterized by enlargement of the muscle, extraocular muscle such as rectus muscle or oblique muscle, usually bilateral, and also there may be hypertrophy and edema of the pad behind the eye, and this is also play a role in the exophthalmos or protrusion of the orbit. In severe cases, they may be compression of the optic nerve, by this bag in this area. So this is a feature of thyroid eye disease. كده خلصنا الثايرويد. hyperthyroid only 3 or 4 slides. اللي هي شنو parathyroid. فهنتكلم عن هايبر باراثايروديزم لان الباراثايرويد هي very small normal parathyroid gland usually not seen by ultrasound, usually not seen. لكن الثايرويد اذا كانت normal it can be seen by ultrasound، لكن الباراثايرويد if it is normal usually not seen. ف لكن اذا كان عندنا في ادينوما or malignancy or tumor it can be demonstrated by ultrasound. طيب for assessment of the hyperparathyroidism احنا عارفين الhyperparathyroidism may be primary or secondary. Primary hyperparathyroidism should be evaluated by the imaging. So all patients with confirmed primary hyperparathyroidism should be evaluated for the لأنه عارفين الباراثايرويد عندها two manifestation of the renal system and skeletal system. So these two parts will be evaluated, renal and skeletal. طيب هي الباراثايرويد بتعمل ايش on the renal? It can cause the renal can cause nephrocalcinosis or nephrolithiasis. مش اللي هي stones. ايوه nephrocalcinosis يعني patient with primary hyperparathyroidism can present with nephrocalcinosis or nephrolithiasis. يعني اللي هي يكون عندنا calcification on the renal parenchyma أو stones, nephrocalcinosis or nephrolithiasis. طيب how to assess this nephrocalcinosis or nephrolithiasis؟ نعمل لهم ايش؟ to be assessed by imaging.
Ultrasound.
Ultrasound can be used, yes, or also you can use what else?
CT.
CT without contrast.
CT without contrast, and also X-ray.
Abdominal
طيب how
X-ray.
nephrocalcinosis and nephrolithiasis appear on CT؟ كيف بتكون شكلها كيف؟ هي ما قاسية في النهاية. Any calcification on CT.
Hyperdense. Hyperdense.
Yes, and how this also مثلا nephrocalcinosis appear on renal ultrasound?
Hyperechoic.
Yes, hyperechoic. And how this calcification appear on abdominal X-ray?
Hyperlucent.
Hyperlucent. Hyperlucent means يعني very black. Lucent black. Hyperlucent more black. But طبعا
Hypo.
ليش هايبو؟ سي تي واكس راي بوث يوز اكس راي، يعني هما الاثنين بيستخدموا اكس راي، لذلك هي الاثنين بيظهر فيهم ابيض، لكن هنا قلنا هايبر دنس وهنا نقول ايش؟ the X-ray.
Hypolucent.
No, hypolucent. Lucent by itself, by lucent is a black area. كلمة lucent دي معناتها هي on X-ray appear black. لكن what term used for describing bright area or whitish area on plain X-ray or abdominal X-ray. اي منطقه بيضاء في الاكس راي، اذا عندنا ستون ان اكس راي بنقول ايش؟
Opacity.
opaque. Yes, opaque.
Opaque.
This is this is nephrocalcinosis or nephro appear opaque. طيب زي ما قلنا برضه الهايبرباراثايرويدزم can be present with skeletal abnormalities such as osteoporosis or osteopenia or uh, bone fragility. And this, how to investigate patient with osteoporosis? What is the imaging modality of choice for assessment of osteoporosis? هشاشة. osteoporosis.
DEXA.
DEXA. Yes, DEXA دول energy X-ray absorption DEXA. Sometimes في بعضهم بيكتبوها DEXA يعني D for energy. Sometimes you can could be written DXA. And also زي ما كان جبنا لكم في الاختبار إنه other option may be used is vertebral X-ray. إذا ما كان عندنا this DEXA available, you can do vertebral X-ray, especially the lumbar region for assessment of the طيب the additional imaging study, we can assess the thyroid by the for surgical planning to know the the abnormal gland, and this can be done by nuclear imaging technique or ultrasound. يعني this is additional إذا كان البيشنت plan for surgery فدي this ultrasound or nuclear technique can be done for assessment of location or for the abnormal gland. This is optional and additional imaging study. But this is so again in normal parathyroid cannot be seen with ultrasound, but parathyroid adenoma can be sampled and demonstrated. فدي مثلا دي parathyroid gland. طبعا اذا جبنا لك الايمج دي اكيد حتى لو اي شخص ما حيعرف انه دي ايش الا نقول له مثلا لانه هي محتاجه انه multiple section او multiple frames او image to know انه this is a thyroid parathyroid lesion. This is but لكن اهم شيء how to describe this. Anyone to describe this lesion?
Hypoechoic region.
Hypoechoic.
And it's well defined.
Well defined. Shape. Is it
circular in shape?
Regular.
Regular. Well defined. Hypoechoic. Rounded or circular shape. Is there any calcification?
No.
No calcification.
No calcification.
Is there any cystic part?
No.
No. Like this also thyroid, ultrasound, thyroid and parathyroid. This is thyroid left lobe and this is right lobe. There is a lesion here. طبعا الليجن دي هي in the posterior aspect of the thyroid. So this is a parathyroid lesion. How to describe this lesion?
Irregular.
Irregular
hypoechoic.
hypocoid. يعني هي of intermediate، يعني هي فيها part hypocoid فيها part تقريبا isocoid to the thyroid يعني. with
Calcification.
يعني في specks of calcification. You are right. Specks of calcification. This is a confirmed. This is a highly suspicious of parathyroid carcinoma and should be biopsied. You have to advance needed to take a biopsy for this on this lesion. Also, this is a lesion in the area of posterior to the thyroid, and in the area of parathyroid gland. Demonstrates this lesion which is hypoechoic behind the left of the thyroid gland. Also, this is CT. You can see the left thyroid lobe and right thyroid lobe. And what is this? What is this vessel? لاحظوا ان دي CT with contrast. So this is the thyroid. What is this vessel? Lateral to the thyroid lobe. عندنا two vessels. Which one and which one?
Carotid.
Common
artery.
carotid.
Common carotid. What is this? It's the common carotid. And what is this? And then two vessels. One is artery and the other is vein. This is the
Jugular.
which one is jugular? The larger or smaller one?
The smaller one.
Smaller one.
Is what? Smaller one is
Jugular vein. Intrajugular vein.
Jugular vein.
اه احنا قلنا the 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 jugular vein is more larger. وقلنا القريب من هنا اللوب هو شنو internal carotid. لو معلش هذا تيجي عليكم لو لانه موضح عليكم هنا في in this one. left common carotid is just adjacent to the lobe. هذه اللي هي أوضح هنا. طيب the smaller is the same common carotid and jugular vein is more lateral. يعني jugular vein lateral to the common carotid. This is common carotid and this is a jugular vein. As the same image can be demonstrated in this one. This is a common carotid and this is jugular vein. And so what is this?
Common carotid.
Common carotid.
This is a
Jugular.
Jugular vein.
what is this? This is abnormal. What is this abnormal lesion? Where is this lesion? Anatomically?
Parathyroid.
Parathyroid.
So it is located posterior to the thyroid. This is thyroid, so this is a parathyroid tumor. But this is a parathyroid adenoma in this posterior. يعني هي موجودة وين؟ Posterior to the right thyroid lobe. But this is a CT demonstrates parathyroid jobs. Do you have any question? You
Yes,
have any?
thank you.
العافية يا دكتور.
If you have طيب concerning the طيب انتوا